Hello, everyone, and welcome to this year's Quie and Peterson Global Health Lecture. My name is Shaili Prasad. I'm the Executive Director of the Center for Global Health and Social Responsibility here at the University of Minnesota. Today, we're going to be talking about the state of global health, the challenges we currently face, as well as potential opportunities for meaningful change. We have a wonderful speaker in Dr. Christian Acemah, who I will introduce shortly. But first, I want to honor two people who have been integral to our center's formation and its current function. Doctors Paul Quie and Phil Peterson served on the original steering committee that created the Center for Global Health and Social Responsibility, and Dr. Peterson served as our first director. Collectively, there are more than 100 years of work at the University of Minnesota, and I want to emphasize that again. More than 100 years of professional work at the University of Minnesota has had an immense impact on countless students, faculty, and partners around the United States and the world. I'm personally honored to have received some wonderful advice, which they continue to give to me. They have created a foundation on which the center was built, and we strive to maintain the legacy of global health equity in everything that we do. So thank you. I know you folks are watching this. Thank you, Dr. Paul Quie and Dr. Phil Peterson. Before I dive into the main event, I do want to bring up a couple of housekeeping items. I want to remind you that this webinar is being recorded and will be available after the event. I also want to encourage you to post your questions in the Q&A section of Zoom, and I will keep an eye on them and post it to Dr. Acemah. This is our 9th annual Quie and Peterson Global Health Lecture. This lectureship has allowed us to bring in some of the best thinkers in global health, touching on everything from climate's effect on health to the COVID pandemic, to establishing a framework that promotes compassion in healthcare. Now, the word unprecedented sometimes is used too flippantly, but we can all agree that we are facing unprecedented challenges in global health. Global health finds itself in an extremely difficult situation, given funding constraints and questions about the future of international partnerships. That's in addition to the historical legacies and the complicated geopolitical machinations. Our topic this year is an ethical imperative, reshaping global health partnerships. Essentially, could this current crisis give us an opportunity to reimagine global health? To address this topic, we are thrilled to have Dr. Christian Acemah with us today. I've been privileged to interact, to work with, and learn from Dr. Acemah. Dr. Acemah has vast experience across various sectors, which makes him an excellent candidate to address this very complicated and multifaceted subject. And now to introduce Dr. Acemah. Dr. Christian Acemah leads the Uganda National Academy of Sciences, UNAS, as its executive director. His career features extensive experience in various sectors, primarily in health and the sciences. He directed strategy and program development for the U.S. National Academy of Sciences, Engineering, and Medicine's Africa program. At the UNICEF and Gavi, the Vaccine Alliance, he worked as a research and policy officer in the CEO's office. His work with Lutheran World Federation Department for World Service involved HIV/AIDS advocacy, monitoring, and evaluation within their Sudan-Uganda program. He has conducted developmental economics research for a World Bank vice president and development anthropology research at Georgetown University. Dr. Acemah serves on the board of the International Network on Government Science Advice Africa, also known as INGSA Africa, and previously served on the board of International Health Partnerships, a joint World Bank and World Health Organization initiative where he chaired the Civil Society Indicator Committee of the World Bank. Christian, we are thrilled to have you today, and the Zoom floor is yours.
Thank you very much, Shaili, and it's such an honor to be here, to be invited to this, to give this lecture And Doctors Quie and Peterson, thank you so much. Your legacy lives on and will continue to do so long after you. I'm very sure of that. And that this is the 9th lecture. Number 9 is my favorite number. And that's because when I turned 10, my mother told me that now it was time for me to take on some responsibilities. So all my younger years of happy-go-lucky ended. So I always treat that 9 as a magical number. For today, I have only 5 thoughts to share. The first one is on the framework for our conversation. I'd love to frame it as a way of giving ourselves permission to do things that we're constrained to do before this moment in history, or to do things that we ourselves stopped ourselves from doing, so to dismantle anything individually that will just hold you back. And so this is a framework from Dr. George James. I give myself permission. So that's the first thing. I give myself permission to speak with you from my heart, with my experience as much as possible, and also to learn together with you. That's the permission I give myself. And there's some things that I rarely say, but I think they have to be said this time, number one. Number two is an invitation for everyone to stay open. As Shiley has stated, we have this unprecedented moment, and there will be more for sure after this one. But in the unprecedented moment, we need to be open to all possibilities and do our best to make sure that the worst of our demons do not show up during a trying time, and that the best of our ideas, best of our practices show up to meet this moment and overcome it, or another way of framing it, to work with this moment to get the most for our planet, to get the most for humanity, and to be able to leave that as a legacy for future generations. That's two. Number three, in this openness, I also request some imagination. And with the imagination comes the things that, the 3Ds, as I'd like to call them, the diagnose, deliberate, design, and there's a fourth one, and actually deliver. And that cycle keeps going on, not as linear as I've outlined it. Okay, so that it takes imagination to really say, what is the problem here? So we don't cry about USAID being dismantled just for the sake that was dismantled. We say, what is the problem here? What was the real purpose of USAID? And reimagine it. I guarantee you there will be a time when we have an institution like USAID again. In this moment, we could ask ourselves, what did not work at USAID? What irritated all of us at USAID? Was it some of the rigidity? Was it some of the branding? What was it? And try to imagine another entity in its place and what it would do, so that then again, it's not so easy to dismantle it. The same goes for all of our funding agencies that are falling to the side right now. It is so eye-opening to see how interconnected we all are in this financing cycle and programmatic cycle. So that is as far as imagination goes for us. And to say that for these Americans in the audience, I would love to say that you partnered with us for decades. Wonderful. Your value did not come only from your money. In fact, your value was you yourselves. And in the moment where you're feeling lost, and I've been to several meetings of American scientists, American researchers, where people are really, they're depressed because they don't know what next. No, even those that are financially stable, don't know what is coming next because that financing piece has been taken away. So what I want to give you as a clear message is that we are here for you. Just because money has disappeared does not mean that you also disappear from our lives. Remember the point on interconnectedness. Now is the time to walk the walk, and how we show up for each other during tough times really is the measure of our partnership. The tough times, because the easy times are fine. They're all right. We can enjoy. We can even say we'll be together. The tough times call upon us to now stand together even more in a real way and have those hard-hitting conversations so that we can actually design things that reflect the best of our intentions, real partnerships built on trust and trustworthiness, built on shared dignity, and also built on the mutual concern for one another. All right. And later on, we'll get into some language issues, so I will not touch on those right now. Okay. Moving on. As we go using our imagination, I would say now is the moment where we have to challenge power. And last year's lecture was on epistemic injustice, and so I won't spend too much time on that one because in the challenging power, we start with that knowledge. Number one, epistemic justice. So that is centered. Whose knowledge do you center? Whose knowledge works best? Whose context can you actually borrow from to strengthen yourself? That epistemic justice, and not erasing the funds of knowledge already existing in our communities. So that is one kind of way of challenging power. A second kind of way is the relational aspect. And this is an aspect where you can also give yourself permission to be a decent human being. What do I mean by that? I'll give an example from my brother, Doyin Odbanjo in Nigeria. Uh, he submitted a proposal, funding agency, and the person there said, look, your proposal, the finance is, the money bid is $4,000 over what I can approve. Is it possible for you to alter your budget in such a way that you don't really minimize, hard quality, but maybe cut a cost or two, because this is money you can probably do without right now. Otherwise, if we go over my signing limit, we have to take this request up several levels, and it might take you even up to a year to get funding if approved. And so that was very easy to change that budget and for the person at the funding agency to sign off on it. That's what now we call relations, being in a relationship where you can actually talk about the inner workings of your organization. At this time, I've had so many people who used to say, here is the framework we have to work within it. Well, guess what? There is a gift here in our hands where the framework has been crushed, or at least the framework as we knew it, driven by the West, has been crushed. So that's not an excuse anymore to be able to work on how we relate with each other. And this is not just a thing of West or North, South, global majority, global minority. No, it happens everywhere, even now local context. I am a very privileged Ugandan. I have had a hard time coming to say that I am, and now how I relate with those who are not as privileged as me, that's a measure of how committed I am to making the relationships work, especially in those communities that some people would love to call beneficiaries or the recipients and so on. So it happens everywhere across the world. So it's a challenge for all of us to say, we're gonna be more decent to ourselves and more decent to each other. Through that relationality now would come the practice of care. And we'll hear about that. Practice of care and responsibility, where we can actually open up to each other and say, here are some things that worked, here are some things that failed. How do we learn with each other? Without a fear that there will be a penalty for not passing the exam of getting everything correct that you put in a proposal. Okay, that is now inhabiting an area of learning, mindset of learning, again, with each other. It's so, in this relational issue, it is so freeing to be able to speak with somebody who does not look like you, doesn't have a background like yours, and you get to know each other so well to the point that you can send each other messages imperceptibly, or you can say, I am struggling right now with a program, but I'm going to get back to it. We'll hear about our report on unethical care and responsibility in global health partnerships. And there are times when I had to say, I am struggling right now, please, but I'm going to get back on schedule. And it happened. But it happened because there were people on that committee who said, all right, we'll give you the benefit of the doubt, not once, not two times, not three times, but multiple times. And that one inspired me to dig deep, deep, deep within me, find that energy to deliver again. Not just a boilerplate thing, something that those on the committee valued very much. Now, the third area of challenging power, this is the temporal area where we say, how long will it take to get achieve results? How long? When we have less than 6 years now to get the SDGs, I think that one is a good eye opener to say how long will it take to get who? I mean, people decided it's a global thing, but I don't think my aunt in the village really was part of that process, or even the district chairman for that matter. I don't think that one was. So timeline. Some things can happen faster in our southern contexts. Other things can happen slower. The same is true or in any other place. So we say, let us see how our timelines work with each other. And we might not be able to meet them, but how do we learn to adjust appropriately so that we are always building on what we've learned prior? And I think now it is, my next message is to say, sustain the hope, even in a moment that could seem so dark. Sustain that hope. It's not for engineering. It is to say that you as an individual can actually be a real light during dark times. Or we can, borrow from Maya Angelou, you can be a rainbow in someone's life when there are all sorts of dark clouds around. A message to our funders in the audience. Now is the moment for you to stand up even more. You might not have all of the skills, all of the funds, or anything near to what we had in the past, but this is not a time to cower. It's an invitation for you to stand up for all the things you've been saying, for all the partnerships you've wanted. Now is the time to show up and really help with the restructuring the frameworks within which we carry out global health. So those are my opening thoughts, Shiley. Hopefully that's enough now for us to get some comments, questions, and answers.
Thank you, Christian. Thank you for opening with those comments. And just a quick reminder to the audience, if you have any questions, please put them in the Q&A section and I will post them to Dr. Acemah. So Christian, your opening comments made me think of admonishment from somebody you know really well, Dr. Ruth Acheng, the Minister of Health from Uganda, who called out fair weather partners. Do you want to talk a little bit about that? Because I think that is something important for us to keep in mind.
Yes, absolutely. So these are the partners who were such close partners, and then COVID came and they ran away because the projection as always, was that Africans are going to die in the millions. So run back home. Our partners left, and guess what? We didn't all die. And then they started wanting to come back. The question is, on which terms are you coming back to us? We are not just interchangeable old jackets. We are humans here who also are deserving of that dignity. So it has helped to say, to have a sense of pride and agency in ourselves to say, you ran away, we didn't die. So you can run away again, and we will not die either. In fact, we can borrow from our Ethiopian friends and say, stay where you are if what you're going to do here does not build us up. So that's my minister's kind of statement, and I hold onto what she says. And it is for, when I think of it closer, it's really an invitation, what she said. It's you call out, but no, I think it's a calling in with her. Come together. Let's talk again about what works, what doesn't work, and learn together. I mean, I think that is going beyond accountability into the realm of responsibility.
Thank you for that. I really appreciate that. One other question that has come up often, and while there is a lot of assessments of the damage that the abrupt withdrawal of USAID does to various parts of the world, particularly in the health sector, you have reflected on the resilience of local governments and countries. Could you elaborate on that? I mean, what role does the resilience within communities and individual governments, what role do they have to play in this?
Oh, yes. And that one is a thing that we are grappling with. We're saying, look, life didn't start with USAID. Development didn't start with the emergence of external partners. Somehow we had moments of growth, moments of interruption, and then moments of renewal. And so let's take this opportunity as an opportunity for renewal, to remember that there are actually available resources where we are. If used appropriately, we can meet our needs. And that, again, is what sets us up for that dignified interdependence. There's been a review in Uganda of the domestic finances, and giving it to where it's needed. And so far, the shocks haven't been so great. I'm sure the people in here who would say, oh, they have been great, and I don't want to minimize their pain, but we are not on our knees out there begging, because there's some level of leadership that says, let us use this moment as an opportunity to renew ourselves based on our available resources. It's a liberating framework.
Thank you for that, Christian. It reminds me of, all the challenges that are inherently present when somebody looks at a deficit-based approach, oh, those poor people have nothing kind of an approach. And you have emphasized the importance of language in this. I've heard you talk about the importance of using capacity strengthening. Could you elaborate a little bit on that? Because that's something that really made a lot of people think when I've heard you speak on this.
Yes, the capacity strengthening seems like a little change from capacity building, capacity sharing, capacity strengthening. In the strengthening, there is assumption that there exists a base of resources, knowledge, human, all sorts of things that we need to move programs ahead. And we all have different levels of resources. So the strengthening now recognizes that, oh, when we come together, we are building upon each other's strength. In fact, what it says, when we come together, we are all equally human. And why not enjoy that aspect instead of belittling and saying, well, we are building this capacity as if there was no capacity present. I hope Sally Stansfield is on this webinar. She told me something now more than a decade ago. She made a comment. She said, well, look, you are at the US Academy, and let me tell you, you may have all the money for the African Science Academies that they are dependent on you financially, but they are also building the capacity of the US academies to operate in Africa. It changed the way I thought about capacity building, hence now the strengthening aspect.
Yeah, while we participate in an equitable dialogue, we build our own capacity, right? So that's a
Exactly.
very important point there.
Mm-hmm.
And then I want us to transition a little bit on that wonderful study, the consensus study from the Uganda National Academy of Sciences on equitable partnerships in global health. And in that, there was a heavy emphasis on shared decision making. Now, I've heard the term quite often over the past many decades, oh, shared decision making, but I've seen that usually it falls to the wayside. What are the important tenets to make this shared decision making happen?
This shared decision making, I think it's very well captured in a sentence. I think this is from a researcher called Mbabazi, who says, if you are not at the table, your issues are not on the menu, period. And so that's the grounding now sense of the shared decision making. And it depends on how you put that issue on the menu, how you state it, and how you show up. And with the shared decision making, I would say, in my experience and the experience of some of my mentors like Nelson Sawankam, you show up. You can be humble, but you have to know your stuff so well that you can't be ignored and that you can always push back when there are things that are not going to work for you. Gone are the days when we would just stand by and clap our hands, knowing full well what had come our way wasn't going to work for us, but did it anyway to please an external friend. No, in fact, when you come to my country, you must sit at my table. You are my guest, and at that table, you are playing very much with my rules, even though you come with your own sense of dignity and respect, and you're a human being, but the invitation is there. Again, it goes back to seeing each other as valuable, not one more valuable than the other. But in our context, you have to show up knowing your stuff so well that you cannot be ignored. And people know if they don't make that decision with your community, it's not going to work. In fact, it won't really be allowed. Sometimes there's a lot of power in saying, no, it's not going to work. And that no will be so freeing. It might be painful in the short term, but in the long term, will be freeing and also give you an ability to sustain yourself.
Thank you for that. I am not going to let the opportunity go by. You mentioned Professor Nelson Sevankambo, so I have to follow up with a good question about Professor Sevankambo. And my question, and this is partly to do with the event we're having immediately after this webinar here on campus about mentorship. What role do folks like Professor Sevankambo have to play in us grounding ourselves in good ethical principles of practice? You've talked a lot about I've heard you talk about what an influence he has had on you and on many other generations of folks around you. So, can you elaborate the influence at the risk of embarrassing Professor Sevankambo? What particular aspects of his demeanor, his functioning, have you appreciated as we talk more about the importance of that in global health?
Mm-hmm. We could spend our whole lecture on that one question. And he would certainly be embarrassed.
Yeah.
But when you see Nelson Sewankambo, I think the first thing about him is how many opportunities he has had to leave Uganda and turn them down. And so that one showed commitment, even beyond commitment to a cause. His entire self was dedicated and still is dedicated to what happens in Uganda, what happens in Africa, and also contributing elsewhere because it doesn't stay contained. As Sally likes to joke with him, it's not a global health conference if Nelson Sewankambo isn't present. So that's the one, that level of commitment, because you can't ask people to work hard if you yourself don't work hard. So it's a very hard thing to follow with him being in the office at 6 a.m. and leaving the office at 10 or 11 p.m. or even later and doing multiple things at the same time. I think that ethic, work ethic, I think that is one thing he's instilled in all of us. The second thing is, as much as I talk about the power asymmetries and them, money being one of those things that brings asymmetries, I also like money. I hope you also like money and the things that come with it. But what we've learned with mentors like Nelson Sewankambo is that you need to know where you're going to get that money and whether that is the appropriate opportunity. And in fact, it turns out most of the time, our engagements, those are engagements that have nothing to do with self-aggrandizement or making any sort of money. It's that it becomes, it puts materiality in its place. I mean, we've learned that one as well. And the third thing, I think, one of the bigger ones, and I'll have two more after, the third thing is always to occupy that space of learning. There is no one time you meet him and he won't have some new idea or be involved in some other thing that people think isn't his expertise. He's there and ready to learn, open-minded, and from everyone. And I think those of us who've had children and taken them to visit him, he's ignored us and focused on the children. He says these are the wisest people. And you can see him in a very different light when he's with children, not just our children, children in Orakai, children in Karamoja. He always looks for them. So that again is the learning and finding that joy in learning. That's the fourth thing. And the fifth thing is to have fun while you're doing the hard work, even in the dark moments. Have fun. And so there's there are moments for levity, and I appreciate that one as well.
You bring the humanity of the person. Thank you. Appreciate that. We have some wonderful questions from the audience, so let's dive in right away.
Yes.
One of this is about cultural differences in global health partnerships, particularly when partners look at money, time, and community with different lenses. How do you bridge those cultural differences?
The cultural differences, and this I'll relate to myself. Early on, as an undergrad, my advisor said, your future is in collaborations. I didn't know what it meant. So your future is in learning everything you can about the United States and being able to communicate it with your communities where you come from, and learning as much as you can about where you come from to communicate it to the Americans. I thought he was just being a nutty professor, but look at all decades now that have passed, and for sure, here I am. It is a thing that's now ingrained. Wherever you are, learn about that place first before you start making judgments or pronouncements about certain practices. And I think it is having a sense of humility and knowing that your culture isn't the superior one or the one that everyone should aim for. Because guess what? You'll find cultures where you say, I wish I was from this place. Because these people really know what matters. Okay, so in my village, for example, there's no way my grandparents could eat food without their guests eating food first. Even when they were celebrating their golden jubilee, they refused to eat until everyone was served. So that is that kind of looking. There's a lot you can see by looking, as Yogi Berra tells us. Uh, that observation, listening very, very closely, including to the just that body language speaks a lot, and then having the time to reflect. Those things in many ways happen simultaneously. And if you capture that one, I think you've gone, you've so many leaps ahead in a global health practice. Yeah, just occupying that humble, I will listen, I will look, I will learn, then contribute.
That's an excellent point. It sort of brings up a very interesting question from an anonymous attendee. Is there an argument to be made that Western partners of power should just stay away with the defunding of the USAID and other such entities? Is it worth exploring that these big players with their prestige and colonizing energy should just stay away? Would you say that is an appropriate approach at the macro level?
At the macro level, first of all, that isolationism doesn't work. And for global health in particular, just our interconnectedness. We saw it recently here with COVID, that we all came to a halt and realized that even though we didn't have the same boats or ship or something ships, we were in the same we were in the same water trying to just survive, all of us. So there is no case to be made for isolationism. That's very short-sighted, and in fact can lead to going back with all the gains we've made in global health and global health partnerships. Even though they haven't been perfect, you cannot deny the impact that Gavi, the Vaccine Alliance, has had, or the Global Fund for AIDS, TB, and malaria. Also, you can't deny some of those gains. And those gains were made possible through intense collaboration, multilateral, multi-country, and we just need now to make them even better so they can have greater impact. So no case for isolationism, because there are creatures like me that cannot stay contained in certain in just well-defined borders. We'll find a way out.
Yeah, that reminds me of that assessment that whatever the challenges with USAID in the past, since 2001, USAID funding decreased mortality by about 91 million people, and about 30 million of them were below the age of 5. So, yes, some massive effect despite its challenges.
Mm-hmm.
And this is a follow-up of that in some ways. How do we get all nations or most nations to understand the importance of global health, global preventive strategies, and all of this to be valued collectively? How do we
Mm-hmm.
then get countries to understand the importance of this anti-isolationism, if you will, and the importance of us all working together?
Mm-hmm. Well, I'll tell you what, the harsh way is seeing diseases that should have been eliminated decades ago coming back.
Yeah.
Resurgence of measles. That's just crazy. Resurgence of MAPS. That's crazy. That's a very difficult way to learn that we actually have to work together. It's very difficult. The easy way is again to recognize that in all of our cultures, there are preventive practices in all of them. And again, I don't have any data right now to back up what I'm about to say, but when people were dying all over the world, people in my village did not really. And they told people in the cities to stay, hey, stay away. You are the sick people. There's something that they had. And we started analyzing. So, okay, look at the diet, look at all exercise done when people are farming, look at all the stressors that are not there, from noise, from potholes, from dealing with funders, all that is not there. So it makes sense that they manage to keep themselves healthy relative to those in urban centers. So there are all those preventive methods. And for the countries that seem to really love isolationism, it's to just, again, point to the fact that these are all arbitrary borders. All of them, no matter what you think. They're arbitrary borders. So why hold on to a fallacy when you can come and actually enjoy the dance with other human beings?
Right. That's an excellent point. I think this arbitrary borders is part of the challenge in itself, right? So, yes. Here is a question from Dr. Peterson. Thank you for your inspiring words. Is asking about what are the characteristics of the strong leaders in global health? Who does manifest that leadership in global health well? Are there exemplars that you look at and say, we should be doing more of this? Or maybe even wish list of how the behavior should be?
There are certainly leaders. I mean, I already talked about Nelson Sewankambu. But even if I do not know how well, the current CEO of Gavi, Sania Nishta, Dr. Sania Nishta, really comes off as that kind of leader you want at a top global health organization because, again, of the way she listens and the way she makes her points. I watched her in Doha last year, very skillfully on a panel, let people know that your egos are the problem. Your egos are the ones making you lose sight of why you got into global health in the first place. So let us collectively recheck our egos. And even at an event recently at the World Health Assembly, she threw away a prepared speech because she said she wanted to listen to those in the room and then respond and listen some more. So there are so many things going on with such a CEO who would blast away and people will be forced to listen because it's a Gavi CEO, but doesn't assume that posture. So there's again that humility and also recognizing that you have even more power when you are not trying to show off. People will look at you differently and listen when you're not trying to shove things down their throats. So those are some of the characteristics there. Because, you know, I talked about Sally Stansfield. I know you, Shiley, you are that kind of leader, very humble, and also who always loves to interact with students and different people. And you can sit anywhere in a small house and talk and laugh. That is, again, those are the essential ways of connecting as human beings, regardless of our qualifications, our high-flying experience, all that comes to the side. At the end of the day, for a leader in global health, I have to be able to say yes if I'm asked whether I can trust you with my children. If I can't say yes, you can't be that leader.
Excellent point. Excellent point. A high standard indeed. Here is a question from Karen Coker, which is very important to look at the future. How are young researchers in Uganda creating their own space for research? And if you can reflect on the role that the National Academies of Sciences in Uganda plays in that, it'll be great. But what are the next steps for young researchers in Uganda and various other places, and how do they go ahead with ongoing work in global health?
For our young researchers, I think what has happened a lot is that those who have started flourishing their careers, they've had wonderful mentors. And these are the mentors who are ready to leave the limelight and let their mentees come up. I was in Nigeria at an antimicrobial resistance meeting, and there's a high-level professor, and she could have talked about how she did this study, published all that. She recognized her mentees. And so the ones who are doing well, they have chosen well, in fact, in terms of mentors. And those mentors say, oh, no, I didn't choose my mentees. The mentees chose me. So that is that. And then secondly, there are also national young academies right now, as well as the Global Young Academy. And they have so many leadership programs. One of them is the African Science Leadership Program run by my friend Connie Shemerere. And that one started in earnest in 2015, I think, or 2016. And the first cohort now is the one mentoring the current cohort. And that is from all over the continent. Like, let us sharpen our skills to, number one, be able to relate with each other. I love that that's an explicit thing at that leadership, in that leadership program. Number two, we can do what academics love, and I'm a recovering academic, so academics love to publish, 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 publish. We can learn all about that, can learn about getting funding, but even now what is in there, you learn about how to be a mentor yourself, because we can all be mentors at any stage in the career. So that's what the young academies are doing right now. Are there gaps? Absolutely, because I talk with frustrated young scientists all the time whose research work is jammed up by those seniors in the machine. And so those are things that really need to be looked into. And then also our young scientists, certainly, there are those who are going abroad and coming back, but I think the vast majority do not. They contribute in other ways to our country, so I don't want to step on them or minimize them, but it would be good to really be mentored, stay in your country, contribute to your country, build up new people in the pipeline, so now they don't have to go away in order to come back. So that is the answer there. Very complicated thing with the young scientists, but again, what matters is what's modeled to them.
You mentioned about the national academies and how it's fledgling and growing really wonderfully. But are you noticing any more collaborative work between ministries of health? And this is a question from the audience. Are you noticing that because of all the challenges, there is more communication and collaboration between ministries, more partnerships being created?
Absolutely. Just at the UN General Assembly, there was a side event on diagnostics. And the ministers in the room, the Ministry of Health, Uganda, Ministry of Health, Mozambique, Ministry of Health, Egypt, there was a South African representative, and of course, nothing's complete without a Nigerian representative there, all talking with each other. And I think together the realization was, oh, wait, amongst us, we actually have a lot. We can stop whining about some of these people around the table and talk with ourselves. We will actually move things better. So that is working out very well. And those ministers, especially those who've been around for a while, they develop their networks where they do a lot just through phone calls and being able to resist certain policies from outside as a bloc. So more happening. There could be more, even more. That would be our joy, even in cross ministerial. But we take what we have and build on.
That's an excellent point. I think this creates that new frameworks of engagement too, isn't it? So, the next question is again from another anonymous attendee. Part of it you've already answered about maybe there was a need for change with large funders, et cetera, et cetera. The question, however, is what is the biggest challenge to do partnerships, and what would a successful end result look like in those?
I don't know if I can point to just one thing that's most difficult in a partnership, but here are the beginnings of an answer. I would say, what brought the partnership there? Well, why do you need that partnership? Understanding the beginnings and the motives and motivations on the table plainly. I think that's number one to a successful partnership. And things not changing partway through, goalposts changing, bait and switch. I think that's great. That would be the first ingredient. Why are we coming together? Okay. And people say partnerships Partnerships are so difficult. Partnerships are so difficult. Let's stop tinkering with them or do away with them. But look, we invite change, chaos into our lives often. Just look at how many people choose to get married or choose to get children. And that is from Heath and Heath. It's amazing how much they invite chaos into their lives. Same with partnerships. Somehow, in all the messiness, as long as we know where we've started and where we are going, in fact, we can even change where we are going, we can stay together and grow stronger together in that way. And the ultimate outcome with a global health partnership, I think, will be developing the global public goods that do not just stop with a single partnership, but can be spread all over the place, adapted all over the place with ease.
Yeah, that's an excellent point. I think we have to sort of reshape that, isn't it? So I appreciate that. I remember our friend Eunice Kamara saying that partnerships are messy,
Yes,
they're needed.
yes.
So yes, yes. Um, Here is a more specific question from Stephanie Smith. How do you think we can do these activities that decenters whiteness and remain separate from the savior mentality? Because
Mhm.
it's possible that a significant amount of global health work in the past has been based on that. So how do we decenter the whiteness aspect of it and the savior mentality part of it?
Well, I would say that is one of the hidden benefits of USAID going away, is that its whiteness has been decentered by force, even though the argument behind it was that whiteness will be centered. It's very difficult living under the white gaze, for sure, and being saved by people who don't even understand what it is you should be saved from, but it's what it is they think you should be saved from. So I think these are forced reset, and whiteness, I think that one will always be, it will always be present, sometimes just in little actions. It is up to us to say we're going to change how we practice. And remember where I started with that framework. I give myself permission not to center whiteness, or say it positively, I give myself permission to center my genuine relationship. Okay.
Yeah.
And I think it falls on all of us, again, in the way we practice, the way we walk through other human beings' lives. Those that one matters so much when you are in our global health world. And so, yes, has there been a huge disruption? Absolutely. I am on the tracker, seeing lives lost all the time. It's a very painful moment. It's not only pain to come out of it. It is a change, an opportunity to say, what do you give yourself permission to do right now?
Mm-hmm.
You as an individual, as a global health practitioner. And that is now what will lead from to decentering whiteness, or in our context, decentering, certain, privileged, qualified people, or decentering the experiences of the urban elite, or those who've captured the state. That is it.
Yeah. That's a excellent point about it. And this is probably a little bit of a follow-up, but in a slightly different way. We've talked about the power of funding, power of the money. How do you think effective use of funds will be if we can reimagine a future where the paradigms are different? What would be a successful framework of funding?
Again, I think successful funding framework, and this one is unpopular in some places, but there is money in our countries. We just have to rechannel it, reprioritize what that money does. And I think if there is funding going to come in any way, and the universe help us so that we have leaders, political leaders in place who are ready to capture another opportunity, such as the one that came in the late 90s, early 2000s, for the highly indebted poor countries, where there's lots of debt forgiven. If that is the funding that comes, then it can release more of the domestic resources to now fund the domestic priorities. Now, after that, if we come together in any other way, we are coming together as equals in all ways to build something better together. That's the way I look at that health financing. Because my friend Diana, who is a health economist, says you always oversimplify things. These economics things are not that easy. And again, relationships are messy. Add economics in there, they will be messier, but we can disentangle bit by bit.
Thank you, Christian. We've addressed all the questions available. Now we have a few minutes. I want, in your closing thoughts, to reflect a little bit on the advocacy for global health partnerships and the work around the consensus study and what reimagining a new future would look like.
Mm. Well, advocacy for global health partnerships, that's been a very humbling journey for me because of the wonderful minds and individuals that I've met through AGHP. And with these folks, we've butted heads sometimes. And, we've had to apologize to each other genuinely many times. And that's how our bond has grown stronger and stronger to the point that, again, we care about each other's families. We care about what is going on in our lives beyond anything that has to do with AGHP. But what I would say is that, yes, the way we've connected as human beings is wonderful. And that's what keeps us engaged in that work. On the consensus report, when I look back at our entire process of coming up with it, was a whole model in relationships being messy because we had people from different backgrounds coming together, seeing things differently, and again, arguing with each other until we got to a joint place and said, okay, we can agree. So it takes time, and one has to be ready to invest that time and lots of effort. There is no one template for dealing with a messy relationship. What has to be there is an open mind and an open heart as well, because you have to be vulnerable if you're going to figure out how to deal with, how to strengthen a relationship or partnership. So I think that's the way I look at things right now. We are currently going through a very painful moment. Even in my institution, I had to worry about how we are going to make payroll, for example. How to worry about a funder all of a sudden saying, oh, our strategies don't align, even though the strategies align perfectly. And in fact, we waited for that funder to make that strategy before we finished ours. It's painful, but in all of it, I say we are growing stronger together as a team, and we will emerge even better and serve even better through this difficult moment.
Thank you. Really appreciate that. And this is a quick note to folks in the audience. I would strongly encourage you to look up the consensus studies from the Uganda National Academy of Sciences. They have a series which are wonderful. But this particular one that Dr. Acemah has been mentioning is about coming up with the ethic of care and responsibilities in global health partnership, which in the title itself catches the nuance that is needed in a lot of the global health partnerships. So thank you. I appreciate it. Unfortunately, we are at the end of time here for our recorded session. I really appreciate Dr. Acemah for your presence and your wise words. Looking forward to more work in this area because, as you mentioned, this relationship can be messy, but we need to continue to do it.
Yes, and have more than a century of experience with all of us. I think that's the inspiration of the two doctors, Quie and Peterson.
Thank you. I really appreciate that. Those of you watching the webinar right now will see a slide that talks about the Quie and Peterson Global Health Lecture. We encourage you to make a gift if you so feel. This fund honors the dedication and efforts of our founders, Dr. Paul Quie and Dr. Phil Peterson. The fund not only funds the lectureship, but we also use it to fund some of our activities in our education space to keep the spirit of the advice that we have received from Dr. Paul Quie and Dr. Phil Peterson. And so thank you all for joining us today. We addressed most of the questions, not all. Hopefully, we'll be able to answer the questions individually later on. But till next time, thank you. Bye now.